Okay. Good afternoon, all of you. I think all of you know why we have gathered here today. You see the title there. It's a cancer awareness. What do we mean by that? First of all, we know what is cancer, what causes cancer. Is it something it can prevent cancers? What are the risk factors? And are we having any screening methods if at all we need to prevent the cancer? This is all we are going to hear from one of the eminent speakers who has been in oncology for quite some time. Okay? Now, why do we have to know about cancer? Why Sachin has chosen this topic as one of the important topics, as we know. Now, the latest statistics gives from there is some authority called a Globacon. It gives that 19.3 million people suffer, and out of that, 10 million people die every year because of the cancer. India is not an exception for that. We know we are in all such things, we are quite forward. That means we get a lot of cancers. So it is important for us at this juncture to know about the cancer. Okay, that's what happens is, why is that so important? Because we, even today, with all the technology improved, we diagnose cancer very late. Why? It has no symptoms. We do call some female cancers silent killers, we call them, because they don't have any symptoms. Suddenly we see them at the last stages, we diagnose them. Until then they are okay. Right now I have 28-year-old girl, very fit, and she's in stage 3 cancer. I don't know what to do for her. We are all having a meeting. This is called tumor board meeting. We are all having for her how to deal with her. And she is perfectly normal, she looks. Okay, that's what it happens with the cancer. And a very few cancers are preventable. Yes, we don't know, we don't have aware. If I ask any one of you from this august audience, do you know that cancer cervix is preventable and it is totally can be prevented? How many hands will go up? No hand will go up because we don't have awareness. That's number one, we don't have. So this is the reason why the cancers are increasing and we are diagnosing them very late. So to know for us, how do we go about this? What are the causes for this? So many things. Why we get cancer? Anybody who gets cancer, they say, why me, doctor? I don't have an answer for her. Very few cancers I can give an answer for that. But there are no answer. But now as science advances, we call something called epigenetics. We used to say, the child who is in the mother's womb is programmed to get what are the diseases, what are the cancers he or she is going to get in her life. That is the level where we talk about what is called epigenetics. Now, to know about all these things in detail, we have an eminent speaker, Dr. Shobha K. She is oncologist from Kidwai, and also she is attached to Cytecare Hospital, Cancer Hospital. Now she has got an excellent academic background. She did, you have seen all from the institutes, reputed institutes. She has done her graduation, post-graduation and masters in oncology. And she is, as I know her for a long time, she is very well with the social work also. Not only she is busy in the institutions, but she has been to do social work. She is the president of something called AGAI KSC. That is, we have got a cancer association, Gynaec Cancer Association of Karnataka. That's a part of the Indian Gynaec Cancer Association. She is the president presently, trying to do a lot of social work, giving awareness and trying to screen the people. I don't want to stand between you and her, and I'll invite Dr. Shobha to start her lecture about the cancer. We are all very anxiously waiting to listen from you, Shobha. Please come, and the platform is yours. Shobha, please.
Thank you. Thank you. Okay. Background. Yeah. Mic is on, right? Thank you, madam, for the kind words. I think you exaggerated a bit. Good afternoon, everyone. It's indeed a pleasure and an honor to be in such a prestigious institute, Sri C.V. Raman Research Institute. Very, very happy to be here, and thanks to Ram Prasad and Sachin and the whole team who has organized this program. I was just going around and knowing the history of this place. I was thinking, I don't know how much I can talk with you people. You are way, way ahead, beyond us, I think. people with great intellect and, creativity, or you're more into research. So I'm an oncologist, oncosurgeon. So I practice mainly gynae onco and breast. But definitely, as Madam said, we are all into this kind of community awareness, where at least would think that we would make a little change in to our people by creating little awareness. So not much of in detail our talk is, but of course what is the reason, what are the preventable cancer, why is it so much affecting humans, is what we will just touch upon. Daphne, sir. And thank you all again for this opportunity. So this in general. So what is cancer? So I think you people being a science, more into science, so all of us know that our body is made up of millions of cells. So each and every cell has got its own function. So new cells are generated for a particular function. It does its function and then it ages and then it dies. So that is a programmed thing. It's already pre-programmed. So it has to go in a balanced way. So whenever there is a hit in this balance, in this program, then a lot of changes start happening. That's what we call as mutation. And over the years, as Madam said, talked about epigenetics, see, there's a lot of slow changes in our genetic material. And so that it becomes normal over the generations, then abnormal, then it started causing more of cancer in that population. So yeah. So as I said, normal, so we know cell division, meiosis, mitosis, etc., then cell function, and then apoptosis of the cell. But how it becomes malignant? So whenever there is a change in the genetic sequence, we call it as mutation, this usually gets repaired by itself. We have a repairing mechanism. So it is rectifiable initially. So a couple of years, whenever immune system is good, there is a repair mechanism gets activated. But as we grow older, or there is some kind of risk factor in our body, then this mechanism is lost. This repair mechanism is lost. The multiple mutations keep happening. And so there will be accumulation of these mutations, and then normal cell won't form. I mean, it keeps surviving, the cell keeps surviving, and it has an abnormal property, that is, it starts multiplying abnormally. So that system of controlling the cells is lost from our body. So accumulation of abnormal cells, it over the months or years, depending on what kind of cell it is, it forms a clump of abnormal cells which is multiplying not under our control. Then we call it as a tumor. So for this, again, our blood supply or other nutrients or whatever in our body, everything goes to this growth. And slowly, once it forms a tumor, then the doubling time and all increases, and fast it grows. So until then, it takes some years to form a tumor, but once the tumor is formed, within months, it doubles. So what exactly causes cancer? So most of our population, when we ask people, most of them say it's hereditary. Yes, of course, it can be hereditary, but not all cancers are hereditary, only a couple of them. So is it diet? So what we are consuming every day? Many of our ancestors have been having so much of, normal food, growing themselves, normal food, and the incidence of cancer was very low then, but now it's increasing. So is there some change in our eating pattern or in our habits, lifestyle? Yes, of course, lot of impact of our lifestyle and hormones. So these are the things, hormone, like, stress. So stress is one important factor which now scientifically they have shown that it is a carcinogen, it has a carcinogenic effect. So not only the other things, stress induced hormones which will have an impact on that cells. So definitely that is an important carcinogenic factor. So some chemicals. So what are the chemicals we are exposed to? So it could be like, when we are driving or walking, the air we consume, Yes, and so many, when occupational things, we are exposed to so many things, like, a carpenter will be exposed to sawdust. It has got some kind of particles which go and sits in the lung or pleura. Over the years, he develops lung cancer, mesothelioma, etc. So similarly, painters, the chemical in the paint, definitely it is carcinogenic. So it could be benzene or different, so many chemicals are there. So he will be inhaling all those. So fumes inhaling, and that will cause over the years. Now it won't cause in a month or two, but his occupation is that. So years together he'll be doing that. And finally at the age of 50 or 60, he'll be diagnosed with some bladder cancer. So in the paints, these chemicals cause one of the reason for bladder cancer. And then asbestos. So when we are exposed to asbestos, CA lung is very common in them. So many chemicals, we are unaware. So that's the reason, like, more of modernization, urbanization, we are cutting the trees, growing more of buildings, more of factories, all that has made a change in our lifestyle. So the price we are paying. Some viruses or bacteria. So what are the viruses? So we do have some viruses which will cause certain cancers. So the most commonest one is the human papilloma virus. So that is the one which causes cervical cancer. So without human papilloma virus infection, cervical cancer do not occur. And it is the most preventable cancer. And that is the most common cancer affecting Indian women. The first one is breast cancer, followed by cervical cancer. Over the years, these two cancers are very common. Breast cancer has overtaken cervical cancer, but these two are still number 1 and 2, and ironically, these two are the preventable cancers, but it is number 1 and 2 in our Indian women. So that virus, and then we have Epstein-Barr virus, which can cause cancer. Then we have bacteria like H. pylori, which is very common for our acid peptic diseases. So over the years, it will cause gastric cancer. So it's all related to our eating habits, our stress. So definitely, these are the causes. So radiation. So radiation, it could be ultraviolet radiation, directly if you are exposed. So whatever the ozone we are talking, I think you are all more aware of it. So we are losing that ozone layer which protects the earth. So direct UV radiation is got more and more hazard to our cell. So it causes it can cause mutation. So sunlight, not in us, in Western countries, whenever they're very popularly, they do the sunbathing over the beach hours together, so they are more prone for skin cancer. So that is due to this ultraviolet radiation effect. Then other radiation, maybe if the kids in their diagnosed with childhood malignancies like leukemias or lymphomas, they are treated with radiation, and if they are not, protected with the shield properly, they can have thyroid cancers or breast cancers. So when they are giving radiation, they have to protect the neck region and the breast region. So if by chance, if it's not done properly and exposed with this, they definitely, over the years, they can have this cancer. And yes, nuclear, atomic explosion, all this releases radiation, right? So we have seen in Japan when the Nagasaki-Hiroshima war happened, so people, females, especially pregnant females who were exposed, not people staying there. Of course, they were all, I think, perished. People staying little away from those places, but the radiation effect was there miles together. So those females who were pregnant and exposed to these radiation, the kids born during that period, when they grew up, they developed breast cancer and thyroid cancer. So that is the effect of the radiation. So we still have wars going on, nuclear explosion going on, and if it happens in Ukraine, maybe if it is a strong one, the radiation might be creeping into India also, we don't know. So that's all unseen one, but definitely it could be a cause for carcinogenesis. So the uncontrollable risk factors are, of course, genetics. So we don't know what gene we are carrying. Sometimes it is transmitted from our ancestors. So it could be a BRCA gene, which is a reason for cause for breast cancer, which is very common. Or it could be other like HNPCC syndrome, we say. their colon cancer. So that also is one of the common genetic mutation where we inherit. So family history, hereditary most commonly is breast, then colonic, then ovarian cancer. So these three are the common hereditary breast cancers. Yes, of course, age. So we are seeing with a good nutrition, good life, I mean improvement in our sanitation, all our life styles, the lifespan has increased. So all the other communicable diseases where the mortality used to happen, maybe because of typhoid or infectious gastroenteritis or tuberculosis, all this has come down. So people are surviving for more longer, like we have senior citizens, 70 years, 75 years, many of them, that percentage has increased. So as we grow older, mutation is one thing we have to think about. So aged people are more prone to develop cancer. So be it breast cancer or lung cancer or colonic cancer, definitely we are prone, age is a risk factor. And of course sex, yes, like breast cancer, being born as a female, we are at risk of developing breast cancer. And certain cancer like prostate cancer in males, because of male sex, they are having prostate gland. It is quite common and now it is increasing, the prostate cancer. So what are the things which we can control, which are under our control? So we have tobacco related cancer. So when we study our book, the first year of our super specialty, the etiology of cancer here, tobacco related cancer, we have a huge chapter. So, so much is there about to study about tobacco. So it's about 130 carcinogenic elements are there in tobacco. So 130. So we just think it's just a puff, 2 puff we take and then they get addicted to it. So I think tobacco, adolescents, they start for just fun or time pass and then, but it becomes as they work and they get into the stress of getting employed or working for the family or whatever, even females. So employed females, being independent, all this habit comes natural, smoking and social drinking and all. Initially it starts as a social habit and then it turns out to be a addiction. So I think with tobacco we have lot of cancers, not only lung cancer. First when we were small we used to just think, okay, smoking causes lung cancer. But it causes many other cancer also. It causes stomach gastric cancer, colorectal cancer, even cervical cancer. So HPV, as I said, it's only causative agent, but smoking, the carcinogen, it passes through the blood and reaches the cervix, reduces its immunity, and then it enhances the process of carcinogenesis there. So many other cancers is related to tobacco and tobacco products. Alcohol, yes, limited, very limited, social is fine, acceptable, as long as you burn it down. Like, you should work out also to burn your alcohol intake. But if it is a habit, definitely it causes hepatobiliary, then bladder, then gastric, colorectal, etc. Pancreas. Healthy diet is always protective for our immune system. See, whatever we consume, it builds up the immunity. So what we consume at 40 is not what dictates our immunity. It's what we take from our adolescence, from our childhood, that builds up our immunity. So suddenly at 50 years, I think I should become healthy now. Let me start eating healthy food. No, your immune system is not going to start building up then. It's already built. So it doesn't help much. Of course, it does help being healthy that time also. But if you, tell your kids or your whoever in and around, from childhood itself, they should start developing habit of eating a balanced diet. So whatever our ancestors used to take, so that is a balanced diet. It could be a ragi ball, a little rice, onions and fruits, vegetables, egg, all this in a balanced thing they used to consume every day. So that definitely helped us. But nowadays, the eating, it's more of just, what do you say, like fast food, how fast food has developed. Even our eating habit has become like that. Okay, something that moment we get, we eat. We don't really care what we are eating, right? So we are so busy with our education, busy with our job, busy with our commitments, everything. So we hardly find a time to eat a proper food. But that makes a lot of difference for your immunity. And then exercising, scientifically, it has been proven that just walking 35 to 45 minutes every day, it improves your immune system. So everything is coming to our immune system now. Cancer. So immunotherapy is becoming popular. Why? Because it is targeting the immune system. So because our immune system is defective, a cancer patient, when the immune system is defective, he becomes a cancer patient. So exercising has shown to improve that immune system. So good hormones are produced. Sun exposure, yes, adequate. Early morning sun, good. Vitamin D, certain minerals are good. So that's a good thing. Then other, as I said, these infections, hepatitis. So hepatitis will cause hepatocellular carcinoma, a kind of liver cancer. So if vaccinated, it's a protective thing. But other, in spite of that, it is a hepatitis B is a sexually or parenterally, like during blood transfusion or IV infusion, it can be transmitted, hepatitis B. So, but these are all preventive ones. So if we take good care, we can prevent all this. Human papilloma virus, that's also sexually transmitted virus. So we'll talk little detail further. Then practicing safe sex, not only eating healthy, exercising or thinking good, you should also practice a safe sex. So that also can lead to certain cancers. Breastfeeding, we always thought breastfeeding is beneficial to the kid, but it is double beneficial to the mother too. So it has got a protective effect against breast cancer, ovarian cancer, endometrial cancer. So breastfeeding. So then female should avoid hormonal or extra dietary supplements, which can lead to lot of side effects. So hormonal therapy especially. So in metro cities, what we have observed that female, even with minimal symptoms, they tend to seek for a hormone replacement therapy, especially postmenopausal females, because after taking the feel-good factor is very nice here. So they tend to keep repeatedly taking the hormonal therapy, which can have a bad effect on the endometrium or breast or ovaries. So, without any guidance, don't take hormone replacement therapy. Guidance also should be from a proper doctor, not half and half doctors. Dietary supplements are not needed, please. We have seen youngsters taking a lot of proteins. So that has a bad impact on the liver. So liver and kidney. So I think that should, anything artificial or unnatural should be avoided. So food, when I said processed food is very common now. So it could be burgers, it could be pizzas or maida, especially made with maida, bakery products, all those things have got a bad impact on our health. So this is the cancer burden in the world. So we are that red region, we're definitely in the 3rd position. So premature mortality occurs. Why premature mortality? Because most of our cancers are detected in the advanced stage. And other Western countries, developed countries, they detect early and treatment is better. So as early stage, cure rate is high, whereas that's the opposite in developing countries. So globally, when you see cancer burden, 1 in 2 men are diagnosed with cancer, and 1 in 3 women. So that is the the burden what we have of malignancy now. So 2020, 19 million cases, new cases were diagnosed. Out of them, 10 million succumbed to death. Same thing in 2040, expected ones are 28 million, almost doubling. So 47% increase in if we go in the same rate. This is what anticipated. In India, this is the new cases. The most common one is the breast, which you see in pink. Okay, see, both when you take men and women, breast is the one which commonly affects females. Then oral cavity. So this oral cavity, it could be lip, it could be tongue, it could be throat, mucous membrane. So all that is head and neck cancers, which is common in men and then women also, but more common in men. As I said, tobacco related. chewing tobacco. Then come our cervix, cervical cancer. So those three forms the major ones. Then lung is very common both in men and women. Then now becoming more in incidence is prostate cancer in males. And colorectal is common, again related to our food habit. Colorectal, the spicy food, the chili, what we take, the one which produces acid. So that first they think it is gastritis, they self-medicate themselves, they take whatever they want, antacid and all. And then later on over the years, ulcers would have formed. Ulcers, if not treated properly, it's very easy to just go to a pharmacy and take a pan. Give me Omaze, give me Rantac, give me pan. This is what everyone asks. No one goes to a physician because again you have to wait for an appointment, pay them 1,000 rupees and take it. This is easier, right? So most of the gastric cancers history, when we ask, over the years they give us history. So that finally they are diagnosed with gastric cancer. In women, see the almost overall 25% is breast, followed by cervical cancer. So which is the most preventable cancer. That is the very saddest part. So following breast and cervix, we have ovaries also. Ovarian cancer is common. And then we have mouth, oral cavity cancers and lung cancer. Endometrial cancer is another cancer which is related directly to the hormones level. In the breast and endometrium is almost related closely, related to hormones. So estrogen level in a female is high, means risk of breast cancer, risk of endometrial cancer is high. So why the estrogen will be high? Mainly related to obesity. So a female who is obese, those fat cells are converted to estrogen. So as she grows older, chances of getting these two cancers are very high. So obesity related cancer, only one topic we can give. So obesity is also, we forgot to add that in the risk factor. Obesity is one more risk factor. So this is men, as I said, oral cavity, then lung, stomach, colorectal and then prostate. So cancer is not emerging, it's already emerged as a public health problem. So government has also identified it as a non-communicable disease. Now we treat this as a non-communicable disease like diabetes, cardiac disease, etc. Like that cancer is treated. So why it has emerged so much globally and more faster in a developing country, that is, and most of them present in advanced stage, as I said. Why is that? Because of the fear, kind of fear all our people have. What fear they have? What if I am diagnosed with something? What if something abnormal is detected? So what? You know, at least something is abnormal. We are not able to get that fear out of their mind. So I think that is the one thing we have to bring out from everyone's mind. Fear of detecting something which is not normal is a good thing. So that at least we can tackle when it is early. But they don't come then. They come only when it is really unbearable, when it is really in an advanced stage, when they can't stop things, then they come, which that time treating is very, very difficult for us. And a stigma attached to it. So going and diagnosing yourself as a diabetic is very fashionable now. I am diabetic and I'm on insulin. That is very fashionable, right? But when someone is diagnosed with a precancerous also, you know, they feel awkward to say that I'm going to Cytecare to get, they feel awkward to say that. I don't know. When I say patient who are not affordable, from nursing home you come to Kidwai means, no, Kidwai I don't want to come. I don't want people to know I'm coming to Kidwai. I said, see, that is the kind of stigma, you know, they have a very kind of bad opinion that it's not that, yeah, well, some people say we can't see the suffering in with the cancer patients, but most of them, what other people will think if I'm going to Cancer Institute. Even if they're coming for a benign condition treatment, they don't want to come to Kidwai. It's like that. So that stigma attached to it is still not gone in our people. And most of them, they lack awareness. So when I go and ask, cervical cancer is common in females. College students, science students, I asked what is the cause, any one of you tell, none of them were able to say it is because of HPV. So I think that's a poor maybe they are into their study, but still I think this awareness at least they should be knowing. At least cervical cancer is caused by this, breast cancer is caused by this. This basic awareness, if many of us have, then it can bring a lot of change in our management. Then, and people who are educated, once they are diagnosed with they go in for alternative treatment than the standard treatment. I don't know why, because I have observed this in many educated people. So they come, esophageal cancer, okay, we need to give chemoradiation. No, 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 chemotherapy, hair loss is there, we don't want chemotherapy. And they go to some person in Shumaga or some person in Mysore, they give us some medicine which claim to cure. Maybe it helps, we don't know, but there are no scientific evidence to say that it is curable with that medicines. So alternative medicines still they have not provided evidence that they can cure it. So standard treatment they have to go for. Then we say you take this treatment, then you go for maintenance whatever you want. We try to counsel, but many of them still they go there, they try, and then it becomes worse, and then they come for palliative treatment. So that's a very sad part. Then of course cost of the treatment. Anywhere malignancy is diagnosed, small hospitals also they make a lot of money. They play with the emotions of the patient. They tell we cure it. So that has got this one. So cost of treatment is little more there. Unavailability of uniform oncology care. So now super specialists are little less. So general broad specialty people start treating, like general surgeon will treat breast cancer or general surgeon will treat gastric cancer, because they will see gastritis, they will see ulcers and all, and they think they can do gastric cancer also. So that is sometimes suboptimal treatment is given. Half and half surgery is done, and they send, later on they send to us. But always first treatment is the best treatment. So there we do lack something, uniformity is not there. So we need to get treated right away, first time with a specialist. That is the best treatment. Yeah, common cancers in men, as I said, head and neck, lung, prostate, colon, esophageal cancer. In women, breast, cervical, ovary, oral, colorectal. Yeah. See, you can see this graph. This is 5-year survival. See, any patient, how effective our treatment is always shown with a 5-year survival or 10-year survival for a cancer patient. So here as we see, this is the stage-wise survival they have plotted. From stage 0, this one. Here stage 4, okay. All the cancers usually stage 1 to 4. Some cancers 0, that is pre-invasive cancer, before it changes to cancer, pre-invasive. So as the stage advances, the survival also reduces. See, you can see from 0, it's almost 95 to 100% we can cure them. Stage 1, 88-90%. But as it goes advanced, definitely the cure rate comes down. So they come in, most of them come in stage 3. They say, "Enu madakagalva, doctor, cure madakagalva." Every day we face this question. But the sad part, they don't come here. That is the very sad part. Stage 3, stage 4, only 15 to 20% is our cure rate. So staging is very essential to decide our treatment, what kind of treatment we can give, and additional along with surgery, whether radiation to be given or chemotherapy to be given depends on the stage to prognosticate accurately. So I can tell correctly, yes, your 5-year survival rate is so much percentage, 10-year is so much with the stage. And always uniform reporting should be maintained globally to know the, when we study the cancers, we will know also what kind. So standard staging is with TNM stages, most of our cancers, TNM, that is, they describe the tumor, they describe the regional nodes, it spreads to the regional nodes. So if it's a head and, yeah? The screening I said, that is a test where we screen general population without any symptoms when they are, we ask them to come for certain screen. For example, in breast, to detect a breast cancer, we call them to come for a mammogram, a female above 45 years. Or cervical cancer, it has got pre-invasive stage, that is what is called as CIN 1, 2, 3 we have, that is stage 0. So if we have to detect that, patient won't have anything, when we see the cervix, nothing will be there. But when we do a screening test called as PAP test or HPV DNA test, then we will take this cell from the cervix and then we see it under microscope and we'll see whether it is a normal cell or an abnormal cell. So if it's an abnormal cell, we'll know that if we don't treat this, it will over 1 year or 2 years, it will go on to become stage 1 cancer. So before it develops a lesion, we have detected the abnormality. So immediately we'll tell the patient that you're at high risk for this cancer, progression to cancer. We need to do a local treatment. So either local treatment or if she is 45, 50 years, we'll say for simple hysterectomy. So that will cure, 100% cure. As the question rightly raised, not all cancers have pre-invasive condition. Only certain cancers have pre-invasive. So most of them, it directly goes de novo synthesis or invasive stage only it goes. Only certain cancers pre-invasive, like very commonly is cervical cancer, gastric cancer, colorectal. All those will have, even breast also, hyperplasia will be there, that is abnormal increase in the cell, and then abnormality in the nucleus, and then it goes for invasion into the basement membrane, that is invasion. Yeah.
Is there any time frame between each stages, stage 0 to stage 1?
Yes, yes. Yes, depending on the tumor biology. So we say some cervix, it is a very good tumor biology. If she is having HPV infection will take certain years to persist. Most of the infection, it spontaneously regresses within a year, maximum within 2 years. 90% of them, it spontaneously regresses. That woman won't even know she had HPV infection. But only in that 10% women, it persists because she has some high risk factors, which I will quote later. So whenever it persists there, HPV infection, if not treated, like if she doesn't undergo PAP test or HPV DNA test, it will keep progressing over the years. And then suddenly it becomes a lesion once it goes into, so it will take 5 years, 10 years, 15 years, that is the latent period. For HPV, it is so many years for cervix. For breast also, the latent period is quite couple of years. But for other like ovary, it might not be like that. Ovary doesn't have a proper pre-invasive stage. It doesn't have. So there within month, like 6 months back, she would be normal. After 6 months, she can develop ascites and come. That is the part which we cannot explain. Certain cancers are like that. But most of the cancer which we can prevent have a good latent period. So that's why we say proper regular screening can help to prevent against these cancer.
Can I ask?
Yeah, sure.
Related thing. So now you said cervical cancer and the breast cancer, both are preventable and also they have the stage 0,
Yes.
which is added advantage for finding it out even earlier.
True.
So then why is it that there is so many, like almost when you see the pie charts, almost 40% of cancers in India, women are facing this. So is it a policy issue that?
Definitely yes. We don't have an organized screening program which is supported by government of Karnataka. Now everyone are aware. Now we are getting. So family and health welfare department have come across now, I think from couple of years only, no madam? Salpa varshadinda ashte. Otherwise there was no organized screening program. Like how we say immunization is mandatory, we wouldn't have PAP test is mandatory for women above 21 years. It was never there. Opportunistic screening is what we had. Yes, yes.
Sorry. How many of you, when I asked to raise the hands, how many of you know about this cancer? And how many of your children have been vaccinated for the cervical cancer? How many of the young girls in the institute have been vaccinated for the cervical cancer? The main thing is awareness. See, government cannot chip into everything for this huge population. Government is doing its best, but it's our responsibility. We have. That's what she stands for it. She goes to give a awareness talk. Why she has come today here, taking 1 day leave in Kidwan? This is for that she has come. So this is all what we are doing. And I have been asking our people to arrange once. When I joined here, I gave a talk about this cervical cancer. I said all our ladies must have been screened and all our girls who are doing PhD have been vaccinated. I want to talk to them. Until now, I didn't get a chance to gather all of them and talk to them. Because this is the poorest awareness, unfortunately, about the cervical cancer in India. That's why we have this.
And for our government, the basic, necessity and importance is for so many other things like education, providing employment, providing housing, all the sanitation, other things are there. And of course, other infectious diseases are there, maternal mortality. So death during pregnancy, during deliveries, the infant mortality, all that they have to tackle. That is more important. So cancer is something, I mean, little, it has a backseat. So, but yes, knowing about it and us ourselves coming forward and asking about it and taking the opportunity when we say we'll do a free cancer, I mean, pap test, we hardly get. People are there full hall to listen to the lecture. But when we call them for pap test, I think 50% of them will return. I think then motivated will be only
Nobody
couple
will
of.
come. Now the government has started NCD projects everywhere. Even we have a big NCD cell in our government health department, okay? And they are trying their best to do it. But there is always a hesitation
Every
by the
district
woman
has, but they don't
to
come.
come to get the screening done for the cervical cancer because it's very sensitive issue.
What's the challenge?
Sir,
What has been the challenge?
challenge is women are not coming to get the screening done.
Internal examination, sir. Internal
IAS,
examination it is. So people will go for delivery. Then that shyness is not
That
there. Nothing is there.
hesitation.
But when we say pap test, that's also done
Hesitation.
internal examination, and then we take the pap from the cervix. So they are shy, awkward. They feel.
In IAC, what I told now, sir, with the chief medical officer, I said, any promotion, all our lady employees must have the screening certificate, number one. All the girl students who are coming for the PhD enrollment, they said vaccination is important. I said, along with other vaccinations which you are insisting on, please do it HPV vaccination also important. That much I could do in IASC. He is incorporating for this year, students who are joining, they are making it as a HPV vaccination compulsory for students. Somewhere we have to do, I think these two organizations where I am a consultant, I am trying to do my best to incorporate these things so that especially IAS is a huge organization where a lot of women employees are there. Even their families, I said, men, their families. HPV
Yes.
vaccination
If
is
it
there,
is
sir.
given
there.
below 15 years, now one dose also is enough, sir.
Up to 20 now
now up
WHO
to-
says we can give. Only one
One
dose we
dose.
can give.
25,
20,
26.
20 is best.
Best.
Now, it
Before
was
they are
50.
exposed to HPV infection.
it was
that is
50.
sexually when before they become sexually active. If you give, that is the best. So
There's
all
a lot
females.
is there, I think. Yeah, we can talk about it. Let us
Yeah.
finish this one so that we'll get more knowledge
I know
about
you will
this.
get bored otherwise. It takes too long. No, madam, that's much needed. Okay, so the different treatment modalities we have is surgery, radiation, chemotherapy, combination of all this and newer methods. So if it is surgery is decided, that's a good thing because it is early stage, localized. So once it goes beyond the thing of cancer cells are that it metastasizes to other organs. It might origin from breast, it can go to lungs, it can go to brain. It might originate from cervix, it can go to a pelvic side wall, it can go to lymph nodes, distant lymph nodes, liver, etc. So that is metastasized. Once it metastasizes, then surgery is not possible, then we go for chemotherapy. So radiation is for locally advanced. So only around the surrounding structures is involved, they can go for radiation. So now newer method is immunotherapy. So as I said, lot of research and studies have gone into the immunotherapy. So they're using our immune system to work to bring good immunity. Yeah, coming to myths and facts. So which is common questions what arises in our mind. Cancer not curable, it's a fatal disease, equal to cancel, death warrant, fatal. That is what every one of us think, yeah, even including me, I used to think like that. Fact is, it is treatable, beatable, preventable, can be cured, but conditions apply. So everything you have, so you're going to get this gift, but conditions apply. No, similarly, whenever we have to treat or cure cancer, there will be certain conditions. It's a single disease. We believe it as a single disease. No, it's not a single disease. It is a heterogeneous group of disorders. Okay, so we can't say, we have seen so many patients diagnosed with similar cancer, similar stage, but behaving differently for the treatment. Some are really, they do very well with the treatment, some they don't do well. So there are a lot of multiple factors which affect the treatment. So it could be histology of the cancer, what subtype it is. breast cancer can be the common breast cancer, but in that we have different subtypes, what cells, where it arises from. In uterus, we have whether it's arising from epithelial or whether it's arising from mesenchymal tissue or like that. So we have different categories where the prognosis of the cancer has an effect. So there are more than 100 different types of cancer. So we have carcinomas, sarcomas, mixed varieties, etc. Each cancer has its own natural history, biological behavior, response to treatment, prognosis and therapeutic implications. So some they'll ask, my neighbor was diagnosed with breast cancer. Why now I am diagnosed with ovarian cancer? I am not doing well. She is doing well. She is survived for 10 years. I am diagnosed with ovarian cancer from past 1 year and I have been taking treatment. So ovarian cancer tumor biology is different, breast cancer tumor biology is different. So each cancer has got different biology. It's very important for us to diagnose the cancer properly, first of all, what kind of cancer. And so it's all a teamwork. So clinician who sees, so why the diagnosis also gets delayed, another reason is that they undergo a lot of tests in multiple places. They'll go to one physician, then they'll go to a general physician, then they'll go to a surgeon, then fourth or fifth they'll come to a cancer specialist. When it takes time, months together it takes time. So diagnosis also, pathologists, they are different, diagnosis will be different. So uniformity is required. So cancer is hereditary. As I said, only 5 to 15% of them are hereditary. Other 90% are sporadic. So it is due to all the lists what we enlisted initially. It could be due to chemical effect, due to biological effect, due to virus, due to bacteria, or due to dietary effect, obesity, stress, all these cause. So multiple factors we have. Those with family history means first degree relatives are affected, the risk for the next generation is slightly high. Second degree affected, slightly low, but still risk will be there. So whenever there is a family history, always document it so that the next generation will be benefited with some kind of risk reducing strategy if we have, we can advise them. So breast, colon, ovary are the commonest malignancy that runs in the family. Cancer is infectious. So this also most of them ask, I am diagnosed with cancer, can I feed my grandchild, can I be with my family? Yes, of course. It is not infectious at all. It is disease of a cell. So the genetic material is abnormal. It is not spread through any fluid or any other secretions. So it is not infectious at all. It cannot be prevented. The fact is it can be prevented. Overall, from small only you should start adopting a healthy lifestyle, modify the risk factors, chemo prevention. So we have certain medications like, previously our grandmothers used to put turmeric powder into our milk. Just half a spoon of turmeric or pepper. It all has got anti-carcinogenic property. So it helps to tackle these abnormal cells. So that is a natural remedies what our ancestors used to follow. So many were there like that which we are unaware of. Prophylactic surgeries, if there is any hereditary factor, genetic problem is there, we can ask them for prophylactic surgeries. So as I said, these are the etiological things which can cause these cancers. So control tobacco and alcohol, so many cancers can be prevented, oral, pharynx, larynx, lung, esophagus, stomach, kidney, then urinary bladder, cervix. So many cancers are caused by tobacco and alcohol. Endometrium, breast also. So with the control of tobacco and alcohol, definitely the incidence of these cancers will definitely reduce. Personal hygiene, especially cervix and penile cancers. So they are more HPV is sexually transmitted virus. So if you maintain a good personal hygiene, healthy sexual habit, this can be avoided. Prevention of radiation exposure, yes, it reduces leukemia. Then immunization, as Madam said, HPV vaccine is the one vaccine where preventive vaccine. So we have therapeutic vaccine, means giving as a therapy for diagnosed cancer. But this is preventive vaccine where we are giving it, anticipating that the cancer will be prevented. So that is a one good thing creation in our science. So then hepatitis B vaccine, that also gives protection against hepatocellular carcinoma. Prevention of air pollution. So we are all contributing towards this pollution, right? So could be air pollution, could be, I mean, the way we are leading our life, everything, we are also contributing to it. We can't blame only the government. We can't blame our surroundings. So we are also part of it. So if we prevent so many other lung cancers, mesotheliomas, all that will be reduced. Treatment of precancerous lesion, like especially in cervix and oral cavity also. This also has got a pre-invasive, this one, vulval cancer, oral cancer. So just an examination of an oral cavity. How many of us go to dentist without any problem? Do we go? Do we get ourselves checked? No, right? Only when we have problem we go. So preventing is when we are normal. When we are normal, we just go and have a check. Or you check yourself in a mirror. I doubt many of us do open our mouth and check anything is wrong. Only when we have some pain, then we'll go front of mirror and have a detailed look. Otherwise, we hardly see. But that is very important because females and males both are affected with oral cavity cancers. So please, not only smoking, non-smokers also can get. Why? Eating habits. So if you're eating spicy food, or if your habit of keeping the food in your mouth for long to one side, sometimes it can, or any ill-fitted dentures. When you apply the dentures, which is not fitting properly, that can cause friction towards the mucosa. And that friction over the years becomes a kind of ulcer, non-healing ulcer, and that can change to cancer. So all these are small things which we tend to ignore.
What do you look for if I open my mouth?
Any ulcers, any reddish patch, any kind of inflamed area, or any burning sensation when you have, whether there is an ulcer or what, then immediately go to a doctor, take treatment for that. If it is non-healing for more than 3 weeks, we'll have to take the biopsy then. So it could be a precancerous lesion. Then people who have this eating zarda or gutka, all it can cause this changes in our oral cavity. Then legislation to control tobacco, all this, etc. Of course, from our government, all that we need support. Prevention of occupational exposure to industrial carcinogens. So wastage, how we dispose our waste is also important. So that is a very important thing. If the industry is very close to where we live, so sufferers are ourselves only, where we inhale that smoke, exhaust, etc. Cancer education. So madam rightly put it, we are not aware of so many things. The awareness is very, very low. So cancer education to seek early diagnosis and treatment. This will reduce all type of cancers. So tobacco, we have spoken a lot about tobacco, but it's a very, very important thing. Mortality, death due to tobacco is in the very, very increasing trend. So tobacco could be smoked or smokeless also is accounted for. So more than 3 lakh deaths, just see, in women and men, 2018 data, ICMR data. Then the effects of smoking not only have an effect on heart and blood, so it can cause heart attacks and cerebrovascular accidents, or paralysis, that kind, or gangrene foot, etc., or lung. It can cause breathing problem, pneumonia, etc. Reproductive, they can turn infertile. A young boy who smokes or a young female who smokes from the age of 16 or 17, at 25, 30 she marries and then she tries to conceive, she can't. So that is one of the important cause for infertility. Smoking and stress, those both. And living habit, of course, no exercise, obesity. So that also it can cause. Along with that, what is that other thing, cataract, ulcers and all. So cancer is also added to this. So 40 to 60% of all cancers, tobacco is the first leading cause, 40 to 60. Then 30 to 40% of it, heart problems it causes. Lung problems, 90% of the lung related problem is due to tobacco. And then tuberculosis, 3 times, compared to non-smoker, 3 times high risk of tuberculosis. And of course, life expectancy is reduced by 20 years. That is a sad part. So remember, tobacco causes painful death, expensive death. You will be losing your money also. Then lonely death, premature death. So you say no to tobacco, alcohol, very limited or occasional, avoid junk food. It appears very, very nice, but I was just appreciating the food served for us today. You know, like it felt so much like a home food and, you know, not much of any, I mean, what do you say? Artificial flavors or whatever, those things are not there. So that's a good thing. So more color, more this one, more colorful food, you know it is harmful. You please think that is only given to us to attract us, but it is very, very, the coloring agents what they use contains, it is a carcinogenic agent. So do not consume more of outside food. So healthy diet is what is recommended with a regular exercise. So yeah, as I said, unsafe sexual practices can cause all these cancers. See, cervical, vaginal in females, anal cancers, penile cancers in males, and oropharyngeal cancers also, because that also can be HPV related through oral sex. So vaccination, hepatitis B, HPV vaccine is protective. See, this is the oral cavity cancer. So we do get people coming with such a big lesion now also. See, it's very obvious, right? One small lesion, but the time they come to us, they would have developed such a big lesion. Why is it? I've been getting treated, they've been giving antibiotics, they've been giving some medicines, I've been taking medicines. So after 6 months or 1 year, they come with this. So it is a head and neck cancer India is one of the highest incidence of oral cancers. 30% of them, of all newly diagnosed cancers are oral cancers. Most common cancer among the men, and mortality also. So any ulcer in the mouth or any patch, it could be white patch or a red patch, or any lumpy feel, any lumps are there inside, or in the neck, lymph node enlargement. So these three are the ones which commonly we can feel there must be some change and the ansathe, but we don't go immediately. We take time. Okay, let's see, it will heal. Okay, I'll take B complex. It's B complex deficiency, self-diagnosed. Many of them just pop in B complex tablets. So that's why it gets delayed. So see, these are the patches. This is quite common. Sometimes diabetic people also, they can have whitish patch, fungal patch. But if it's not healing for more than 3 weeks, definitely go and get a biopsy done. So early detection of cancer is highly curable. Treatment is very less invasive. Very simple treatment, that time it will be. Just surgery would be enough. But if it becomes second stage, third stage, along with surgery, you'll have to add up radiation also, which is, you'll have to add up chemotherapy also, which is very, very tolling on your mental status also. People definitely will get depressed thinking of chemotherapy causing hair fall, hair loss. That is the most disheartening thing for them. So less morbidity also, of course, and improved functional recovery. Like, you know, when it is a small tumor, they just excise, I mean, with the wide local excision, curative. If it's a big one, they remove the whole part, mandible they'll remove, then they'll do some cosmetic surgery, which takes up or do not take up, then only later we'll know. They'll give radiation, they'll cause disfigurement, sometimes nerve will get injured, they'll have facial palsy. So functional speech will be different, there will be discrepancy in their speech, eating, swallowing they can have difficulty. So as the tumor becomes big, the treatment becomes complex and the morbidity due to treatment becomes more. So breast cancer, yes. So for every 2 women newly diagnosed with breast cancer, 1 woman dies of it in India. See, almost 50% of them die. So as I said, the treatment starts late. So risk factors, age, people, family history, and age of menarche and menopause. A girl who has attained a menarche early, like 10 years, 11 years, or who is getting a menopause late, could be 50, beyond 52. So many of them are still menstruating at 52, 53 now. So they are exposed to estrogen for a longer period. So definitely the risk is high in them. Then obesity, as I said, fat cells get converted. Oh, that is one of the common risk factor. HRT, as I told HRT. People who do not conceive, who are infertile, so they have this inherent risk things. As I said, there are a lot of hormonal changes then they don't breastfeed, which is a protective factor. All these have got increased risk of getting breast cancer. Alcohol consumption and smoking. Protective is having a kid at a right age. Right age means anywhere between 20 to 25 or 28. After 30, if you conceive, the chances of getting breast cancer is slightly more. After 35, the risk increases. Yeah, so this, as I said, all can be controlled. So what is the symptoms? How you know you are having a breast cancer? Like cervix you can't examine. So pap test is the only thing where your doctor can do and tell you there's something abnormal. But breast, every female will know. There will be some kind of lump, she will know, she'll notice, but she will ignore it. She'll think, oh, maybe related to hormones, related to my periods. Let me just wait for some months. That's what most of them think. So a persistent lump or thickening in the breast or in the armpit. So that is one of the common symptom of the, just today I met a girl came morning, 26-year-old. She was, she underwent lumpectomy, I mean a lump in the breast, thinking it is a abscess or galactocele they thought, and they removed that lump. Finally it has turned out to be a cancer, ductal carcinoma. So 26-year-old girl, and she delivered 2 years back. So what is the cause for this? So especially young girls, we think that hereditary factor is strong in them. But nowadays we are seeing even in that 35, 38, 40 years also, the incidence has increased. So we feel estrogen levels from the uterus itself, they are exposed. Fetus is exposed to excessive estrogen. That's what we are thinking. Like adulteration in milk. The cows are induced with hormones, right? That same milk we are feeding our kids. They are growing up with that kind of food, with that kind of milk. And why menarche age has reduced? 9 years, a girl is getting her periods. Before it used to be 12 years, 13 years. Nowadays 9 years, 10 years, they are getting their periods. So they are prematurely exposed to hormones. I mean, that is one thing what we are thinking. So those things, and changes in the contour skin of the breast, or inverted nipple, retracted nipple. So there must be some tumor or something causing it to invert or retract, or any discharge which is blood stained. So that is also one symptom, or a change in the size of the breast. So there is some discrepancy in this. So these are the common thing which a female can observe whenever there is a lump. So lump, 90% of them, they come with a breast lump. So any lump, be it a younger age group, of course all lumps are not cancer, especially if it is in younger age group. It can be a fibroadenoma, simple fibroadenoma, but unless proven otherwise, think it as malignant. That's what we say now, because we are seeing in younger age group also, any lump should be evaluated by a specialist. So breast, what do you recommend for screening? As I said, we have to take care. So what is the awareness we give? Do a self-breast examination regularly. All females from the age of 20, they should start examining their breasts. So after their periods, on the 8th day or 9th day, examine bilaterally both the breasts, both the armpits, sitting position, standing position, sleeping position, 3 positions also. Or when you are taking a shower, after application of soap also, if you palpate, you can appreciate. If any small lump also is there, you can appreciate. So every month, only once, don't keep examining repeatedly, only once after your periods on the 7th day or the 8th day, start doing self-breast examination. You can Google and see the technique how to do, then from the age of 20. So as you reach 40 years, go to a clinical breast examination, go to an expert, could be a gynecologist, could be a physician who can examine the breast properly, or a surgeon, so, or an oncosurgeon, anyone from the age of 40. From the age of 45 years, we recommend screening. From other Western countries, sometimes they even say that from the age of 40 years, you can go for mammogram. But for our females, from 50 years is what we say, but from 45 years, if you do, no problem. Above 45 years, all females should undergo mammogram. So, which is not picked up in our hand, can be picked up in the machine. Okay. So what is the advantage of picking up then? So, as I said, simple treatment. You can preserve your breasts. Only the tumor will be excised and no need to take chemotherapy. No need to give radiation. Of course, breast conservation, when we do, we give radiation, but chemotherapy can be avoided and breasts can be saved. We don't have to do a mastectomy. We don't have to remove the breast totally. So, breast conservation surgery, yeah.
Why would, I mean, mammogram brings out something that a clinical examination will not?
Yes, yes. So, lump can be felt only when it is more than 1.5 centimeter, and depending on the density of the breast also, sometimes we can miss out 2 centimeter lesion also. So, if it's a dense breast, we can miss out. So, these mammogram is one which picks up even a 0.5 centimeter abnormality.
But then why no mammograms for less than 40 years?
Because it is hazardous, it has got radiation, so we can't do it from early age itself. So, from 20 years, we can start examining. Okay, then treatment option, the same thing. Cervical cancer, just 2 slides about it. HPV infection, not all females who are sexually active will get HPV infection once in their lifetime. But not to worry, it doesn't progress to become cancer. Only some few of them go on to persist the infection in themselves, and then that will have some changes and become cancer. So, who are those females who are high risk? What are the high risk factors? So, these are symptoms. The high risk factors are not put. Okay. When she has started a sexual activity, so early she starts a sexual activity, higher risk for her. Early she delivers a baby, like if she delivers at the age of 17, 18, 19, definitely the risk of persistent HPV infection is high. And if she has multiple deliveries, like 5, 6, 7. So we used to, our grandmothers, so many, if you take history, most of our grandmothers, they said, radiation togondu kirvayalli, she was diagnosed with cervical cancer. That was very number 1 then. So all this was due to early marriage, multiple deliveries, conception, and then trauma to the cervix repeatedly, that immunity goes away and the HPV infection persists, that becomes cancer. Nowadays what? Early marriage is not there, but early sexual activity is there. Multiple sexual partners are there. Then bisexuality is there. So homosexual is there. So HPV infections are common between homosexual partners. So anal cancers are common, penile cancers are common, oral sex is common. So that also goes on to have persistent HPV infection. So they are at high risk. Otherwise, most of our HPV infections are spontaneously regressing. So what are the common symptoms? Abnormal vaginal bleeding. Anything which is abnormal should be evaluated. Or any bleeding or spotting after a sexual activity or after a pap test. If there is some bleeding, then we say it is abnormal. So there is some kind of spotting after taking pap smear. So we have to evaluate this further. So that is one early sign. So cervix looks normal, but there is some kind of bleeding, spotting. It is abnormal definitely. So we'll have to evaluate. That is the most common symptoms. Intermenstrual bleeding or postcoital bleeding or postmenopausal bleeding. After menopause you get bleeding. So that is one, this one. Apart from that, once it becomes locally advanced, then they'll have persistent backache, persistent thrombosis of the leg, means swelling of the leg, or they can have sometimes, if it invades the bladder and rectum, which is close to cervix, they can have passage of fecal matter, passage of urine through the vagina, which is a very pathetic condition to see the patient, really, and most of them get abandoned in that stage. Even the family people, they just don't take care of them. So that is even around 5 to 10% of them still come with that stage. So what do? Pap test from the age of 21 to 29. We advise all female who are sexually active to get a pap test every year. Then from the age of 30, HPV DNA test. So that we will know whether that high risk HPV DNA is there or not. If it's there, not to worry, we will tell what the precautions to be taken, what kind of treatment you have to undergo by chance there is abnormality in the cervix. So until 65, we tell them pap test and HPV DNA test. After 65, it is optional. If it is normal, it's abnormal previously, then accordingly we'll advise. So these are the screening tests available. So the very simple test, people don't have to be afraid of this, just 2 minutes it takes. Just come for an internal examination. This is a spatula, broom-like thing. We just take one 360-degree rotation and then put that brush, we put it in the fixative, then take the cells there and then we fix it in the slide and examine under microscope. So I don't know why people are scared, it will be painful, it will be all that. So females need not be scared. Simple test, 2 minutes test, okay. So get vaccinated, yes. So certain types of sexual behavior increase the women's risk, as I said. So in having sex at an early age, multiple sexual partners, or oral sex, or homosexuality, all those. Then condoms, to some extent it will prevent, but not completely. Then smoking is another risk factors. Then micronutrients deficiency, nutritional deficiency, that also reduces your cervical immunity. So whatever food you take, you should have good antioxidants, folic acid rich food, vitamin C rich food, vitamin A rich food. So these will improve the local immunity. So even if you have HPV infection, most of the time with a good immunity, it can be resolved. So vaccination is the best thing what has happened to the girls now. So before they are sexually active, vaccinate them. So we don't have to tell them you're getting into sexual activity, that's why I want to vaccinate. No, just make it natural like any other vaccination, like rubella vaccination or mumps or influenza or whatever vaccination we are giving in childhood, we are incorporating this also in their immunization schedule. So that's what was thought and started in the government, but due to some kind of unpleasant incidents, it was taken off. Now because of the cost issue, they are not incorporating into the immunization from the government, but it has been accepted and it is like a standard for a pediatrician to give vaccine to the young girls. Yeah. So this is the vaccine available. Indian vaccine also is available, which is at a lower cost. The cost has come down, now 1,400 or something they are telling, but still they are telling another couple of years, maybe it will come down to 300, 400 rupees, hopefully. So we can cover more of the girls. So, yeah. Lung cancer, this low dose CT thorax, this we can't apply for the general population, like how we do a pap test or a mammogram for general women. We can't go on doing a low dose CT thorax for all general population. It doesn't help much. But a man or a woman who is a chronic smoker or a highly obese patient and who have lung problem, breathing problem, when we suspect, we can ask them to start doing this low dose CT thorax. So small, because lung cancer as such, until it becomes a big lump in the lung, they won't know the symptoms. So that is a sad part, but high risk population, definitely we can advise this, otherwise not for general population. Yeah, I forgot my glasses, that's why. Okay, with adults, no, it's okay. So they are saying, like, 7 out of 8 adults who are know that they are at risk, they do not go for screening. That's what study says. So see, this ignorance, that's all. Even after knowing, they don't do this kind of test. Ignorance is what is that. Then colon cancer, certain here also, now it is accepted that you can do certain tests for detecting colon cancer. It could be from the age of 45 to 75. It could be in the way of colonoscopy, flexible colonoscopy, or there is some fecal tests are there. So antibody related fecal tests are there, stool examination. So that they can do from the age of 45 to 75, because it's so common nowadays, we can do. But symptoms are also quite evident in this colon cancer. There will be some disturbed bowel movements, like you have constipation followed by loose motions or bleeding while passing motions. So most of them think it is hemorrhoids. It is piles they think, and they just take stool softeners. But whenever you have problem, please go to a proper clinician, evaluate properly, and then only start your treatment. That's what I think every one of us, that basic thing we should have in our mind. So what about prostatic specific antigen test? So this is against the prostate cancer. As prostate cancer is increasing, is this test going to help our males to detect prostate cancer early? No, actually not. Why is it? Because it is not specific So though prostate has got some levels of these, this one in the blood, it can be elevated in certain benign conditions also, not only in prostate cancer. If they have some, this one like, certain infections or urinary tract infection, UTI it can be, or benign BPH, benign prostatic hyperplasia, which is very common in older men. So there also PSC will be elevated. So what do we do? Do we advise? But nowadays they have included in screening program, PSC can be detected. So we take serial levels. If the level is slightly high now, next year how much high the level has become. If it is too, the difference is too obvious, then we ask any other problem with the urinary. Hematuria is one common symptom of prostate cancer, or difficulty in passing urine. So these two are there. So whenever any difficulty is there, please note it down and tell your clinician. So you can cure cancer, but conditions apply. As I said, it should be detected early. Earlier stage cure is high, later stage cure is bad. See, and diagnose properly. As I said, category wise, what is the histology, what is the level, what are the subcategories, everything should be diagnosed accurately. It could be it a pathologist or a cytologist or cytogenetics or a clinician. First of all, we should know whether it is a colorectal cancer or an ovarian cancer. Symptoms might overlap, but we should know as a clinician. Then we take imaging help. Then we take a pathologist help. So all these combined together, accurately we diagnose and treat accordingly. So optimally we should get treated. So we can't let someone staying somewhere far, like a radiation oncologist. Any clinician, so many of them say, I give chemotherapy, right? But at what rate they will give? Because they will be staying little away from the high centers. What they tend to do, give under little low dose. They want to give, but they will give low dose, fearing for the toxicity of the proper dose. So that's what many of the peripheral people do. So you have to give the proper treatment in a proper center. So optimal treatment should include proper dosing and schedule. Maintain the dose intensity and density. This is not followed. See, we have, we call as GTN in girls. We get that in young girls, gestational trophoblastic disease, which is highly curable. But why so many of them come with recurrence? Because it is mismanaged. So somewhere in Tumkur or Shumaga, they give half-heartedly, like, what dose we give, they give half dose because of toxicity. So that should not be done. So adherence, completion of treatment is a must. If it is 6 cycles, give 6. If it's 8, give 8. Adherence to the protocol is mandatory. Compliance to the treatment should be maintained. So treated by an expert is a must. Surgical oncologist operating, general surgeon operating makes a lot of difference. So gynec oncologist operating, surgical oncologist operating for gynec cancers make a difference. They have compared this. They have done study, published paper also. So for ovarian cancer, a gynae oncologist operating is definitely the best. So medical oncologist giving chemotherapy is definitely the best what we can do. So yeah, I think we have covered most of it. So any doubts I can take. Thank you.
I think we have an extensive talk about cancer. And for 5 minutes, I think we'll have questionnaire. If anybody has got any doubts, she's here to clear the doubts.
Sorry, I think I took a little more time, I think.
The screening in general, how often one should do, and if one does a screening, does it indicate all types of cancer?
Not really, sir. Not all cancers can be prevented, and screening is one test where it should be applied to a general population, which should be accepted by them, which is feasible to do, and which detects this one before it become cancer, that is pre-invasive stage or early cancer. So all this, and it should be cost effective. All this should be fulfilled by that test. So those tests only
His question is for every
screening, that's what. So those kind of screening tests are very less. So we have it in cervical cancer, accepted one. We have it in breast cancer. We have it in oral cancer. Then we have it in, actually now, colorectal cancer, prostate cancer. Apart from this, general screening tests are less. Opportunistic screening is there, means whenever they have any problem, like if they come with a heartburn, maybe we'll tell endoscopy. So that is a different, diagnostic it becomes. But screening is for a normal person who has no problem. So only few cancers it is.
My second question is that you didn't say anything about the skin cancer.
Skin cancer. Skin cancer is not very common in India, so we don't give much importance to that. So skin cancer as such, ultraviolet radiation is one of the main cause for that. So squamous cell carcinoma is quite common. So even if it is anywhere on the skin, if it's seen, it is highly curable. Melanoma is one more cancer, skin cancer, but that is slightly aggressive variety. So, but since it is seen obvious, most of them come in early stage itself. So, otherwise it's not very common in Indian population.
But
so
we see it's common with dogs. We see very much.
I am not much aware of dog this one also.
Is there any blood test which can detect cancer?
No, not really. Now we don't have specific thing, but for ovarian cancer, we do have something called as CA125. So it is a protein, I mean, it is expressed, and that normally it is circulated in our body. But whenever there is elevation, increased levels of CA125, then we know something abnormal is there. So it could be some tumor. So that's how we do. So usually this in a high risk group we do, not as a in general population. So if a female has a family history of ovarian cancer in her first generation, I mean first degree or second degree, this one, 3 generation they take history. If any positive history is there, then we'll advise them this test along with the transvaginal ultrasound levels of CA125. And this PSA also is a blood test, that prostate specific antigen, that is also a blood test for prostate cancer. So usually these two are the ones, otherwise not many tests are there which, but lot of research are going on with this circulating tumor antibodies, CTC what we call. So that might in future, so if we do a urine examination or if we do a blood test, maybe the CTCs are detected in high number, can show that some cancer is forming in the body. So that is the research happening. But now the CA125 and PSAs.
Thanks, madam. What are the side effects observed after vaccination? Is there any statistics?
Yeah, according to the studies, this has been almost there since 18-19 years and not made no major side effects at all. So this trial actually stopped because there was a couple of deaths
in Andhra.
But this came in the front page first because of in the trial of vaccination, death happened, and so we have to ban this one trial and all. They stopped the trial, but later on they came to know the deaths were due to some natural cause, not due to the vaccination. But that was again not started, the trial. But then it showed that there's no major side effects at all, nothing to do with their fertility. It doesn't affect the fertility nor affect the nervous system or any other system. This minimal is redness, local redness, erythema, pain. Sometimes they might have some giddiness after taking the injection. So we make them to lie down for 15 minutes, 15-20 minutes, observe for some kind of changes, then send them.
Yeah, and after this pandemic, there are a lot of immunity and things like that it's drastically gone down. With that, are there any research done now for the vaccination, keeping pandemic in view of that?
No, not
yet.
It's
Too early to do that. It will take at least 5 to 10 years for us to come out the effects of it. So it's too early. Only thing we have seen in the girls is who have been affected by the COVID, they have got a lot of menstrual irregularities. That's the only thing which has come out now with the studies. Effect on the vaccination, on the cancers, yet to know.
Sir, I think another thing what you want to know, whether antibodies are produced against this virus, like for COVID. Antibodies are produced, sir, against the human papilloma virus infection, but these antibodies are very low in circulation and very weak to have that long-term memory. So it doesn't give that long-term antibodies in the body. Like for any other virus, we do have our natural antibody production, right? For this HPV infection, these are very weak antibodies produced, which do not stay for long. So that's why we need this
Vaccination.
synthetic vaccine. This has showed that antibodies levels are remaining high and the higher. So that's why the protection is high for the girl. So even if you give at the age of 15, the protection might be there till the age of 50 or 60 of us. Still it has to go on. That's why we say in spite of girls getting vaccinated, we have to keep them under screening. Pap test is also must for them. We can't just ignore because this is just a vaccine of 15, 20 years vaccine.
Hi. So the circulating tumor cells detection that you have mentioned, so that is when the tumor has been already formed and then they are breaking down and then that is coming in the stream when we...
Now what studies, I mean, I am aware of it is, who are already diagnosed, they have taken the sample of the tumor, they have taken the urine from that person, they have taken the blood from that person. And they have compared the levels of the CTC in all three samples, in the tumor, in the blood, in the urine. And then this has been published and then they're going to apply this to, whether they can apply this to normal population is what they're thinking of. Especially in the CA bladder, those kind of this one. Still we don't know whether in normal it is applicable or what. So studies are there now where they're seeing in a general population you take the blood and look for these CTCs. You got the point?
No, my point was that this CTC, detecting of the CTCs in the different kinds of fluids that we have in our body.
Yes, yes.
It is possible when the tumor cells are breaking down and they're coming in the streamline. So it is a good technique for
recurrence and this one
yes,
you're saying.
yes, while the medication is happening,
exactly, yes.
if the medicine is actually helping in...
Correct. The
yeah.
point is correct. Now present what it is helpful is for this. But they're trying to put this, apply this thing to normal population also. Studies are going on. So especially CA bladder because we were involved with colorectal cancer and bladder cancers. They have identified certain 5 or 6 CTCs which are produced in this recurrent CA bladder or who are getting treated. And then they want to see whether in they come with some stones or some UTI, those kind of patients they will see whether the CTCs are there or not, elevated in them, normal population. So studies are going on. So maybe in couple of years we might get the result. Whether in normal population also this level, when it is elevated, whether they have progressed to become diagnosed with cancer or what. So like a screening test they want to apply. So it's still not accepted, I mean still in the trial process. So what question you asked, same question was there in their mind and they're working on it.
When you say do a biopsy, is that expensive because you need someone to spend time, look at the cell samples and all that?
Yes, sir.
So now if everyone starts
Yes, sir.
doing biopsy of every single lesion that I see, that will swamp the system, right?
Yes,
so
sir. That's
how do you, I mean, how well are general physicians equipped to be able to say this one you should do a biopsy, you should do not? But I mean, this is anecdotal, but
No,
I know
no,
of
no,
a lot
right.
of people who had, they say, oh, it's all started with some lesion on my nose, and I
right.
ignored it because everyone has something or the other, right? So,
You're very rightly you asked, sir. This is a very common question, and that's the reason most of them gets ignored by the patient themselves and sometimes by the physician, clinician also. Because see, post MBBS people will be practicing, post MS people will be practicing. But during their study, how many of the actual cancer they have seen? Not much. So as an MD student, if you ask me, cervical lesions, what we see will be hardly couple of them in the whole 3 years. Maybe we would have seen some 6 to 7 cervical growth. So we actually don't know, and by the time we pass out and come, we would have forgotten that also. So exposure to that normal lesion, abnormal lesion won't be there clear cut for most of the doctors who are not in that subject. So if we are exposed more and more, every day now after my MS I came and joined in Kidwai, I started seeing cervix. So I know some benign conditions are there which can mimic malignancy, like now in breast lump. So breast lump, the cancer has got typical feel is there. Fibroadenoma, which is a benign one, it has got typical feel. we can appreciate only when we see both of them adequately. So that is the reason we say any lump should be treated as cancer until unless proven. So because the incidence has risen so much, now any abnormal growth is a must. If it's not healing for more than 3 weeks, you have to get it biopsied. So even though the clinician thinks, no, it is not, I feel this is this only, but if it's not healing for more than 3 weeks, get it biopsied. Maybe it can turn out to be tuberculosis, tubercular ulcer, which is non-healing with antibiotics or your anti-inflammatory or your B complex. So you will get some diagnosis with a biopsy. So biopsy is a gold standard to diagnose some abnormal lesion which is seen. It could be anywhere from mouth to toe, anywhere. If anything abnormal lesion is seen, we biopsy it. Even if colonoscopy, if bleeding per rectum, if they complain, they might think it is just hemorrhoids. So they get treated for hemorrhoids for 2 or 3 months. And they have to follow whatever changes the doctor, surgeon asks, they will follow. But in spite of that, repeatedly they have bleeding per rectum, they have to go in for colonoscopy. If in colonoscopy somewhere some reddish area is seen or some small polyp is seen, they might think it looks benign looking, but it is mandatory, they have to take it for biopsy. When patient is symptomatic, when you see something abnormal, biopsy is a must. So that will, in spite of taking that, sometimes they have missed out diagnosis of cancer. So we have seen now colorectal cancer diagnosed now, but they'll give us, 2 years back I did colonoscopy, biopsy was done, it has come as benign. So it can turn into malignancy, or sometimes the pathologists or cytologists, some areas they can miss out. So it is there. So that is the thing what is lacking, because it is the super specialty. I mean, oncology as such, we have very few people going in that area.
See, boils down to say that you have to choose it right doctor at the right time. You have to choose. That
And
is.
no-
But now, yeah, as a public, general public, we won't be knowing. We go and believe the doctors. That's what exactly we have to do. If it is not my purview, I have to generously, or we have to refer to some specialist. That has to be there even among us also as a professionals. And a public also, now that you have a lot of awareness about this, why we are giving this awareness is to know that when you need to know to go to whom. That's mainly we give awareness only for that, for you people to guide when to go to whom. As she said, unless we see the cases, we will not be able to diagnose it. Unless we have a high suspicion in our own minds that this I have to rule out in this patient. That concern has to be there.
And finally, we should know ourselves, our body well.
Yeah.
So if our hunger is good, if we are eating, we are able to digest what we are eating, if we are doing our routine work normally, if our bowel movements are good, if our sleep is good, undisturbed sleep, we are able to do our routine activities without any problem, this system, our system is good. Any kind of deviation from this system, you will know your body is in trouble. Then you will think, why is it like this? So you feel something is burning in, epigastric pain you have, burn you have. You will then think, what did I eat? I ate green chilies? Okay, you observe. If there is some buttermilk or something you take, it comes down, fine. It might be due to what you have taken, food. But again, evening you have some kind of discomfort. Then you have some like tightening of your chest adjacent. Then you have some sweating. So it is not gastritis, it is some kind of cardiac event. So immediately you should know it's not gastritis. So people tend to ignore these small changes. So that is the problem where we are losing the early diagnosis. So self-diagnosis, self-medication, very close friend of mine. So he is having epigastric pain and he refuses to accept that he is having cardiac problem. He is saying gastritis. It's gastritis. I know, I have eaten this, that's why. Then angiogram, we get it done, there are blocks. So it's we have to accept certain facts.
Keep saying colorectal, but esophagus is
That's
the
also,
upper part.
sir.
Doesn't that give
That also gives, sir. That is
cancer?
also definitely. It's related to food habits and stress, especially stress. All this GI from up to above to
so
below.
the entire thing is susceptible.
So eating habit makes a lot of impact on this gut system. So please, every day passing motion regularly is a must. So for that, healthy food, diet, high fiber-rich diet, and water. Most of us don't consume water. That is the problem, biggest thing, lacking thing. Because water is one natural thing which flushes out the toxins from our body. So we have to consume at least 4 to 5 liters of water every day. We are working outside, we think how to visit toilets, so we avoid drinking water for that. So that is the main reason. But lot of diseases come because of this. So I think this is a natural thing which many of our diseases can be avoided. So eating habit, eat at the right time. So as our elders used to eat heavy breakfast, mediocre lunch and light dinner, early dinner. That is the best thing you can do to your body. So finish your food by 7, go to sleep, early to rise. So system is balanced. And of course, because of stress, every one of us will have work related or studying, anything. So workouts. So just a walking will give so much of good hormones. That has got a neutral effect on the bad hormones. So some meditation, yoga. So whatever the yoga poses we do, that is for the normal mechanism of all our, to flush out the toxins. So malasana, the posture we sit, the squatting, the Indian toilet we used to have, that was the best thing actually. Because it used to increase our pressure and then our bowel movements used to be very easy. So that's eating down, eating with in our hands, all this had some scientific relevance. So eating with our fingertips, so it's the nerve endings are attached, so you can't overeat using your food, and digestion is better. With sitting and eating, you can't overeat. So as soon as you feel that is adequate. So these are all small things which made a lot of difference then for our system, which we have lost over the years. So we keep eating with a spoon, we don't know when we will stop, we keep eating.
So go back to our ages of our grandparents' age,
And
what they were
people
cooking.
are,
Yeah, they are trying to do Indian things, and we are
We are
westernized
following.
totally, and unfortunately we
Yeah.
have lost our culture. And everything what our ancestors have done practically in the house, day-to-day life, everything has got a scientific basis now. It is proved beyond doubt now. So let's go back to those things, especially as she is insisting on food habits and the stress, to release the stress. Every day we used to pray in the mornings, that release, it's a good day we start with. All those things are very good in our culture. Probably let's come back to that culture, and at least for our children, let us imbibe those things for our children, not totally to westernize, so that we can prevent them from all these disasters of health issues. Thanks a lot. We thank Shobha for an extensive awareness talk on the cancer. I think all of us will follow. And we request Director Sir to come and give
Thank
her
you
the
for
moment.
this such
Please,
a
sir,
nice,
please.
wonderful opportunity
Please.
to be amongst you people.
Yeah, please.
It's a great honor, sir.
So much.
Thank you, sir. Thank you. Sir, great.
For all of you, there's a high tea is arranged below, down the thing building. Please, all of you attend that and have a tea. Thank you very much again for all of you to be there until though it's very late. You have been here. Thanks, and the directors are coming and again joining us. And really thanks a lot for you. Though you had a busy schedule and meeting, you could make it. We are very happy for that. Thank you.